Bismillahirrahmanirrahim. Assalamu alaikum dear viewers. I am Dr. Muhammad Usman Bashir, Professor of Physiology, and in today's short video we are going to talk about various major errors of refraction. Now there are four major refractive errors, that is myopia, hyperopia and astigmatism and also presbyopia. Now first of all we will talk about hyperopia. Hyperopia is also called far-sightedness because the person is able to see the far or distant objects clearly, but he or she has difficulty seeing near objects. Now in hyperopia, as you can see here, the light rays coming from a near or close object, they are focused behind the retina rather than on the retina. They are focused behind the retina. Usually the hyperopia it results from too short eyeball, that is the size of the eyeball is shorter than normal, or sometimes there may be the refractive power of the lens may be less than the normal. So in hyperopia, the person, in order to see the near objects, he constantly uses his accommodation. So constant accommodation can lead to the spasm of the extraocular muscle and it can lead to the headaches. Sometimes it can also lead to the blurring of the vision, and rarely it may cause strabismus or squint. Hyperopia can be easily corrected by using a convex lens which is placed in front of the eye as is shown here. When we use this convex lens, the refractive power of our natural lens or lens system of the eye is increased and image is formed on the retina. Now myopia or nearsightedness is another error of refraction in which the person can see the near objects clearly but has difficulty in seeing the far or distant objects. In case of myopia, the light rays coming from a distant object, they are focused in front of the retina rather than on the retina. Myopia is just the reverse of hyperopia, and it usually results from an eyeball which is longer than the normal. As you can see, this eyeball is almost oblique and it is longer than the normal eyeball, so that the light rays, they are not focused on the retina but they converge in front of the retina, and person cannot see the far objects or distant objects clearly. Myopia is said to be genetic in origin, but there are certain conditions which accelerate the development of myopia, like extensive close work, too much studying, too much screen time. Myopia can be corrected by using a concave spherical lens or biconcave lens placed in front of the eye, and when we use this lens, the light rays are focused on the retina. Astigmatism is such an error of refraction which is not due to defect in the lens, but it usually results from defect in the curvature of the cornea. In this defect, the cornea is not 100% spherical, but curvature of the cornea is not uniform. There are actually two planes which refract the light rays in different directions. Some light rays are focused on the retina, as you can see here, but some are focused in front or behind the retina. So accordingly, astigmatism can be myopic or hyperopic. Here you can see a picture of the cornea, in which you can see there are two planes. One plane is AC and the other plane is BD. The plane AC, it has got less refractive power, so it is focusing the light rays distantly at this point. This is the focal point for plane AC. Then another plane BD exists in the cornea, which is not like the AC plane. This BD plane has got more refractive power. This has got more refractive power, so it bends the light rays close to the cornea at this point. So this is the focal point for plane BD. Now what happens as a result? We get two images. Two images are formed, one here and one here. So the resultant image, which is seen by the brain, it is blurred. Astigmatism can be corrected by using cylindrical lens which converges the light rays only in one plane. which focuses the light rays only in one plane. So in this way astigmatism is corrected and the person can see the objects clearly. Presbyopia is basically decrease in the power of accommodation with occurs with age. The power of accommodation of a child, suppose at the age of 10 years, it is about 14 diopters. Then at the age of 45 to 50 years, it is decreased to 2 diopters, and at the age of 70 years, it is only 0 diopters. Basically, the presbyopia occurs because increasing hardness of the lens with age. Because with advancing age, the proteins of the lens, they are modified and they get denatured. Just like hyperopia, the presbyopia can also be corrected by using a convex lens. Hope you would have understood the basic errors of refraction in today's video. Please consider subscribing to this channel. Happy learning to all of you. Allah Hafiz. Thank you for watching.